Yeah, that's our topic today. This is in commemoration of the 2023 International Day to Ending Obstetric Fistula. Of course, we know that this International Day is observed at every year on May 23rd. Of course, today is May 23rd, and it's International Holiday for gathering support and spreading awareness about this particular ailment we're talking about, obstetric fistula. It's a childbirth-related injury that majorly affect women in poor economic regions. Our guest this morning is seated right here in the studio, but first, let me talk with my co-presenter. AJ, how are you doing?
I'm fine. Well, obstetric fistula. I think I'm lost in this because.
Okay, you said I thought you said you are obstetric fistula. I was surprised.
I think I'm lost. I'm lost.
No,
in
you
this,
can't be lost.
No,
You
no.
can't be. I know what you're doing. You can't. You actually can't be lost because I know what you're doing right here. But we have an expert, a professional
That's
right
what
here
I'm
with
saying.
us
So
in the studio
I'm really.
that will help us out.
I can't wait to learn a thing or two about this. Probably, maybe this might, will I say, remotivate me to go and study medicine. What do you think?
At this age. Okay, let's not go there. We have our guest seated right here, and she is Dr. Jane Ezono. Dr. Jane Ezono is the chairman, Nigerian Medical Association, NMA, Anambra State. Glad to have you on the show.
My pleasure.
You're welcome.
Good morning, viewers.
All right. Okay, just before we delve into the day that we are commemorating today, that is ending this particular ailment you are talking about, we want to know exactly, give us an overview of what obstetric fistula is and the people that suffer from it.
Obstetric fistula refers to a health condition where you have a hole between the birth canal, that's the woman's birth canal, and the bladder or the rectum. Or it can be both in some cases. It is a condition that is caused by prolonged obstructed labor. Okay. So just like you rightly pointed out, is associated with childbirth. And when you have that kind of situation in a condition where there is no access, timely access to quality obstetric care, so this is the hallmark. And it is a situation that one can rightly refer to as being neglected. Is a neglected public health issue, and then it's also a neglected public health right. So that's what fistula is all, obstetric fistula is all about. And then talking about the epidemiology, according to WHO, about between 50,000 and 100,000 women suffer from this situation at the global level. And then it is also estimated that about 2 million of these women, especially those living in poor economic conditions, don't have access to treatment. So this statistics is quite worrisome, you know, bearing in mind that it is a condition that is preventable and it is a condition that is treatable.
Let's talk about some of the factors that actually trigger this. Is it some of the things that some women do when they are pregnant, or is it something that is hereditary? What actually triggers this particular thing? Or is there no cause for it to, you know, happen to any woman?
In most cases, it is, like I said, is associated with a prolonged labor,
yes.
You know. And especially in women or maybe girls who are not mature enough, they've not developed biologically enough to go through the rigors of childbirth.
Okay.
So it's often seen in child marriage, for instance, and then is associated with poor and low socioeconomic status. People who actually are affected come down with symptoms like leakage of urine, it's that bad, leakage of fecal matter. And you can understand the kind of situation associated with this kind of health issue. Sometimes the people feel shame, and then they feel kind of a social stigmatization, and social seclusion. So sadly, these are things that are not forefront. It's not a burning issue. It's not being discussed currently.
Yeah.
You know, it's left at the, you know, some are totally unaware of this situation. So these are the predisposing factors, like I already hinted, include things like gender discrimination,
Yeah.
and then social marginalization. So these are the issues around it. But we also have cultural practices that also kind of present risk factors.
What kind of practice?
Like, for example, here in Nigeria, in the northern part of Nigeria, we have cultural practices that promote child marriage.
Okay.
So these are the issues to watch out for. And this is the beauty of a day like this.
So now, talking about this ending obstetric fistula, is it a global thing? Because you're talking about the underage children being put into marriage. I don't think that should be a global thing, because I think Nigeria, like you said, in the north, things like this do occur. What plans, based on the fact that you are a medical practitioner, what plans are you guys doing to make sure that things like this are reduced to the barest minimum, so that children don't get into marriage and suffer things like this?
Like I earlier hinted, it's a global issue. I already stated the WHO statistics. It's a global statistics. 50,000 to 100,000 women and girls suffer from this obstetric fistula. So it's a global issue. And then there are many organizations
fighting against this.
Sure, at the forefront you have organizations like United Nations Population Fund, Champions Global Campaign Against Obstetric Fistula. At the Nigerian Medical Association level, NMA, both at the national and state level. We also contribute our own quota. That's what we call continued medical education program. It is an opportunity we use to train and update the medical professionals to ensure that they have updated skills on obstetric care. So we also use the opportunity to organize campaigns and public enlightenment program so that people should be aware. And when you create awareness, it's a way to handle stigmatization. It's a way to give the affected people sense of belonging. And the idea is that at the end of the day, no woman is left behind, especially the understaffed population and the women who are in low socioeconomic status.
No, I'm interested where you say you talked about creating awareness, because that's the most important thing. A lot of people, they are unaware of this particular condition that we are looking at today. But now creating awareness, of course, I know that one of the things we are doing now is creating awareness right here on ABS TV. But what about those people? Because we made mention that this is happening in the hinterlands, those people that are living in a poor economic environment. So how do we take this message? How do we take this to them so that they will understand? Because most of them, when they get pregnant, they don't even visit the hospital, no antenatal care, nothing. Some of them is just these self-acclaimed midwives that will birth their child for them. And these are the people that suffer it. So how do we take this particular message, creating this awareness to people in this in this environment?
This is a task that is before every stakeholder. In as much as NMA, we organize medical outreaches. For instance, during some programs like our Health Week, the Physicians Week, we bridge this gap. We send this message home, working with the press and then working with the media, just like it's happening now. We seize the opportunity of a day like this to also create posters, which are mass-produced to create awareness. Because like I said, awareness, creating awareness, getting people educated is a level of empowerment and is very critical in dealing with stigmatization associated with obstetric fistula. Thank you.
And I think the other part of the creating the awareness, there should equally be, because recently we've been seeing cases of child abuse where adults, you understand, molest children, getting some even pregnant, you understand. When apart from creating an awareness, the NMA, as the Nigerian Medical Association, do you guys, facilitate punishment so that this would deter people, so that the awareness you're creating wouldn't be falling on deaf ears, so that people will know the penalties, the punishment that goes with people perpetrating such acts against underage children?
Yeah, the Nigerian Medical Association, we collaborate with other institutions like human rights organizations. And then, just like I said, it's something that should be given a holistic approach, starting from building the right system. If you have the right system in place that ensures that there is timely access to obstetric care, delivered by trained professionals, then taking it up from there, you can prevent it from happening. You know, what we often say, prevention is better than cure.
Yeah.
And there are ways to actually prevent fistula. There are three cost-effective strategies you can use to prevent fistula. One is ensuring that there is universal access to timely and high-quality obstetric care. And then secondly, is to ensure that people who take charge of birth delivery are trained, skilled personnel with midwifery skills. This is, you can't, since we already know the origin, if you don't have these things in place, you won't make much impact. And then thirdly, talking about strategies, is making sure that there is universal access to modern contraceptives. So these are the things that should be put in place to prevent. So aside these cost-effective strategies, we also have solutions like making efforts to kind of delay first pregnancy. So it's critical. Everything should be channeled towards condemning and fighting against child marriage. Then other solutions that will help is cessation of all those harmful practices. Okay. So this is creating the awareness that these have side effects. You can imagine the trauma. It's a lot of it's actually a mental health issue.
Sure.
Because you see such women, apart from, you're stigmatized, they think it's their fault, they think they are deficient. So these are the myths that should actually be handled while we deliver the campaign. So apart from, there are other things that should be put in place. There should be continued advocacy for a resilient health system. A resilient health system that will ensure that all these things are put in place. Good governance, advocacy for political will, because like I said, it's something that should be given a holistic approach.
You did mention of one of the ways to stop is delaying first pregnancy. Now, my question is, because we are all learning, and I bet people watching us this morning are learning, when is the right age for a lady to start thinking about, getting pregnant, conceiving, and having? When is the right time?
Adulthood.
Like age?
21.
WHO still defines adulthood at 18.
18.
So it's expected that at that age, the woman's reproductive organ is ready for childbirth.
So it doesn't have anything to do with the physical appearance, because we know that some girls, even at 18, they still look like they are still petite, underage and all that. So it doesn't have anything to do with the physical appearance.
But the physical
Well,
structure.
that's the WHO definition of adulthood.
Okay.
So it's expected that all things being equal, we have conditions that can delay onset of adulthood. Yeah, medical conditions. But that's the WHO definition of adulthood. And the aim is to ensure that first pregnancy does not happen during childhood.
We have a caller here. Hello, good morning. Okay, if you want to be part of our discussion right here on ABS TV, all you need to do is just to dial the number displayed in front of your television set. Remember that we are looking at ending obstetric fistula. Of course, today is a day we are celebrating the International Day to End Obstetric Fistula. And of course, our theme for this year is End Fistula Now. Now, looking at this team, ending it now. I mean, we've talked about a whole lot, what we are going to do and all that. Now, this year's celebration, what is the NMA in Anambra State? What are your activities to see when we look at the team that we are trying to see how we can end it now? So what are your activities today to say that this particular team come to actualization?
Okay. Part of the activities is the one happening currently.
Right.
This public awareness. Mm-hmm. And then we are, in a very short time, we are having an annual general meeting, NMA Anambra State annual general meeting. And it's part of the package we have put up. Part of the activities of the events will be taking this discussion to the grassroots level. Mm-hmm. So active campaign, sensitization of the public, creating awareness and education on obstetric fistula. And like I mentioned earlier, we have a program, we have continued medical education program, which happens at all levels of the Nigerian Medical Association, both at the national and state level. Mm. And this is a program packaged to update professionals, medical professionals, on the skills. Because you can't give what you don't have.
Exactly.
On the skills, those skills we talk about that are necessary. Midwifery skills, for instance, to ensure that the process of childbirth is safe.
Is the cesarean operation, that is the CS session, is it not a way to preventing this obstetric fistula when underage children tend to, be put in a family way?
Okay, having a proper antenatal care is critical as well. Proper antenatal care. It gives the medical professional the opportunity to follow up this pregnancy from as early as possible, to ensure that with assessment, you'll be able to tell a woman who is at risk of having the prolonged labor. So these are ways also to prevent.
Okay, talking about prolonged labor, in our country we are too religious. There are some people that you notice when they come to give birth, and you tell them that probably they need to be operated upon, like the CS session and all that. They will tell you that their fate is against over their dead body, that they will deliver like the Hebrew women and all that. Now, as a medical doctor, I know you must have encountered such, or you must have heard in your while in practice. So how do you deal with issues like this, and knowing fully well that the life of the woman and the baby will be endangered if the CS is not carried out immediately? And most times, even the spouse, the husband to these people, we will not want to sign, or the parents, whoever that is with them, will not want to sign. They will tell you that they are going to deliver like the Hebrew women and all that. So how do you handle such situations?
I understand exactly what you mean. Apart from being the chairman Nigerian Medical Association, this is also my background. I'm a public health consultant. I'm a public health physician. And from my experience, what you said is a common occurrence, even here in Anambra State. And then part of the sensitization program is to also educate people. We try to educate people, give them all this information, sensitize them. And then we also try to engage press, using press to reach out to all these churches, yeah, and as a way to handle those religious practices that also predispose young girls and women to obstetric fistula. So it's something that brings on board all stakeholders. It's a call for action such that every stakeholder should deliver on their own mandate in curbing this menace. And then let me quickly also say that the Anambra State has also shown some commitments. Recently, Anambra State government, led by the Honorable Commissioner for Health, Dr. Afamo Bidike, launched what he called the Anambra State Emergency Medical Services and ambulance system.
Yes.
So this is a way to go. It's a step in the right direction because it will provide the so talked about emergency health care. So this is quite commendable. So it's a call for every stakeholder. Put hands on that. We all know the key stakeholders. Central, we have the press, we have the media. NMA Anambra State collaborates with these bodies. Okay. And where this is also a call, because the question is how far, how well have we fared? So this is a call for us to step up efforts, and given the kind of experience affected women go through, it's something that should be motivating enough for people to help them out and see what we can do to prevent this situation happening.
Okay, so quick one, how fatal can this condition get if a woman or someone that is involved is not well taken care of at a particular time?
Yes, like I said, obstetric fistula predisposes to even chronic health conditions. So many things can happen if the patient is not taken care of. You have complications that may arise, and some of them are life-threatening actually. So we can never overemphasize the need for prevention and then treatment. Treatment is essentially surgical treatment, and then it should be backed up with social reintegration, social reintegration and rehabilitation. So this is important to circumvent those possible health-threatening complications that can arise from untreated cases.
Okay. All right. Okay, go ahead.
So even after treatment, if a lady wants to have a child again, after treatment, there won't be a case of that fistula reappearing, or is it a one-time treatment, or after childbirth then you can treat?
Yeah, the chances that the person will go ahead with subsequent pregnancies is high, especially when the case is handled by a trained professional.
Okay.
Okay, so you mean that once you treat that, the person is okay and can go ahead and still take it and have other safe pregnancies. But if not well handled, it can still reappear again.
Not just reappearing, there could be other complications
okay,
that may even lead to secondary infertility or even death.
Wow.
Yeah. Especially where the situation is handled by quacks. So this is more of the reason why we should bring this issue to the center, to the forefront of international conversation.
Well, apart from the fact that you have already said the good work that the Anambra State government is doing through the Ministry of Health to see that our health is secured and all that. Now, in what way or what ways can the government come in? Because we're talking about ending this now. Apart from Anambra, we're talking generally Nigeria now as a country. What ways can the government come in and help with this situation? Help women that could be, in danger or get this particular ailment we are talking about, that's obstetric fistula.
Okay, Anambra State or government should key into WHO advocated strategies. I mentioned 3 cost-effective strategies. These should be taken seriously, and there should be plans in place to implement them. One is ensuring that there is timely and high-quality obstetric care. It should be accessible. to that poor man in hard-to-reach places. There should be arrangement to provide for those services. And that's why I still commend the state for the initiative they've taken to launch the Anambra State Emergency Medical Services and Ambulance System. Like I said, is a good starting point. So there should be sustained effort, training of professionals, ensuring we do everything possible to ensure that childbirth is supervised by trained personnel with midwifery skill. And then there is need to ensure that modern contraceptives is made available, universally accessible to the citizenry. So, and then other practices, this is not peculiar. Child marriage is not something you can say is peculiar to this part of the country. Yes. And then we should also sensitize, just like you talked about, some religious practices. We should also channel
the religious leaders also have roles to play in this.
Sure. There is need to sensitize and educate them. So, and then continued advocacy should go on for political will, intensify efforts in putting all these preventive strategies in place in Anambra State.
And even probably training, because the go-to place for child delivery in the interlands are the known midwives. So those two can be put into the web of retraining, you understand, so that they get to know, because like we will talk here, most villages, most interland locations don't have health facilities, but they can rely on those trained midwives of experience over the years. So if
I totally agree with you, because like we earlier said, you can't give what you don't have.
Yeah.
In places, we know that one of the challenges we have is having those healthcare
facilities.
And then the trained personnel,
yeah.
Ordinarily. Every birth should be manned by a doctor, but we know where it's not feasible. We have the midwives, so there is need to train and keep retraining them to ensure that they have all the relevant skills to deliver on the required high quality obstetric care.
Okay, we are still right here on EBS TV, and we are looking at the topic ending obstetric fistula. Of course, we are going to take a short break right now. And when we come back, we still have our guests seated right here in the studio with us, and we'll continue with our discussion. So stay with us.
Ndi Anambra, una putagola.
Ibolachi.
Good morning, Ndi Anambra.
Welcome to Good Morning Anambra Breakfast TV show on ABS TV.
Let's do it together.
Bia Kaido Kwa.
We serve it sizzling hot.
Health and lifestyle. Security. Topical issues.
National development.
Entertainment and more.
Welcome to the flagship show, where we arm you with the right tools for the day.
Keeping you abreast with happenings and information within and beyond the state.
There are so many things to gain staying tuned to
Good Morning Anambra on ABS TV.
Good Morning Anambra, live on ABS television, weekdays 7 a.m. to 10 a.m.
Glad to have you back. We are still on Good Morning Anambra, where we are looking at the topic ending obstetric fistula, International Day of Ending Obstetric Fistula. And here in the studio we have Dr. Jane Ezonu, who happens to be the chairman, Nigeria Medical Association, Anambra State Chapter. Doctor, what challenges do you see in actually achieving this day of ending fistula? This is your 2023 theme of ending obstetric fistula. now? What are the challenges you foresee or you think you have in achieving success in this?
So at the national level, we have a weak health system. We have a very weak, very fragile health system. And even within the country, we also have geopolitical variations, because we understand that traditional and religious practices differ from one region to the other. So even if you're able to achieve much, the little effort we put in at the eastern part of the country can be marred by the gaps we have. Because this issue has, from statistics and documentation, is more prominent in the northern part of the country. So there is need for holistic and national efforts at the national level, sustained efforts at implementing those 3 WHO strategies. And then more importantly, combating those traditional practices that increase the risk of obstetric fistula.
All right. Earlier in your submission, you made mention of all stakeholders to get involved, that all hands needs to be on deck. Now, who are the stakeholders that we are talking about now, and what are their roles? What roles should they play to see that we end this now?
Okay, we have a myriad of stakeholders. The government at the state, national level, state level, even local governments. We have the Nigerian Medical Association. We have human rights organizations. And then we have non-governmental NGOs, international, national, even Christian-based organization. I think they have a lot to contribute in handling those religious practices we already talked about. And even the women leaders, they should be at the forefront. The press, the media, along the course of
course.
Yeah.
So what about the traditional rulers? Because we made mention of cultural barriers or cultural practices that can also be one of the factors.
Thank you so much for also calling my attention. They are also major stakeholders. And I generalize when I said everyone. In fact, by the time you name, you will see that everyone, that we all have a role to play. So these are the major stakeholders.
All right, I also want to ask this question. Now, these women or these young ladies, when they get pregnant, especially these people that are just getting pregnant for the first time, and they start going to antenatal for checkups and knowing how their baby is and their condition general, their health condition general. This kind of discussion, do you have it, like talking about this obstetric fistula and probably dangers if they fail to adhere to giving instructions to them? Do they, the people there, maybe the nurses, the midwives that teach them, do they actually lecture them on the dangers of this particular condition?
Thank you for that question. When you talk about midwifery skills that we have so much emphasized on along the course of this discussion, it doesn't just start with childbirth. It starts with the antenatal care services. And at that level, we employ the use of trained counselors, who man or participate in the ANC services. Yeah. So it is during these repeated visits, antenatal visits, that the trained professional seizes the opportunity to educate the attendants, and then they also seize the opportunity to conduct what we call risk assessment. Okay. So, and this will determine the kind of services the particular patient gets along the line of the antenatal care. And then sometimes one of the observations, just like you also pointed out, is what we call high risk group. which some of them, there are categories of management we recommend for those. And at the tail end may even be recommendation of cesarean section, what we call elective cesarean section, such that you don't even allow this particular person, depending on the risk assessment, to go through labor
at all.
So these are the mechanisms that are put in place. And that's why we can never overemphasize training and retraining of the professionals that deliver obstetric care.
Since this is a global issue, are there drugs that the WHO or even the medical field they are trying to bring in order to reduce this? Because cultural, when you're talking about fighting cultural and religious, let's say norms, it will be very difficult. But are there drugs that one can take in order to either reduce the chances of a child, of a lady going through this thing, or probably kill it once and for all, so that we don't have our young girls getting this fistula, obstetric fistula?
The WHO has not recommended any drug that will prevent obstetric fistula. You know, we went through the causes and then the risk factors. So these are the things that should be addressed. So there is no recommended drug that a girl child or a woman will take to prevent obstetric fistula.
Okay, just before we go, what's your word of advice to people listening to us, especially women, mothers, young girls, people that are about to maybe get married or start having children, start having kids, and also all the necessary stakeholders that we've mentioned on this show today?
Okay, in summary, just like I earlier pointed out, obstetric fistula is a neglected public health and a human rights issue. It is not a discussion we have. We don't have that discussion, and that has been fueling the stigmatization associated with this. It is treatable. It can be treated through surgical procedures and then followed up with social reintegration and rehabilitation.
Okay.
So all hands should be on desk. It's a discussion we should go on and on to, first of all, put things in place to fight stigmatization and then to prevent child marriage and all those risk factors we already mentioned.
Okay. Well, apart from the fact that it can be corrected through surgical procedures and all that, you know that this will require some amount of money, of finances to carry that on. And we know that some of the people that suffer this are the people in those poor economic environments. Now, those women that are already suffering this, are there things that they need to be given to actually manage the situation pending on when the surgical procedure will be carried out on them? Because you talked about
there's
leaking
need.
urine and all that.
I agree with you. There is need for, because one thing is providing service. Another thing is making it accessible. Both financial accessibility, geographic accessibility. So the government should also come up with packages that will make these services for people who are already suffering from this obstetric fistula, to make sure that they can access, find a way to package to make care accessible to this group of people.
Okay, we want to say a very big thank you to you, Dr. Jane Ezono, the Chairman, Nigeria Medical Association, NMA, Anambra State. Thank you so much for being part of the show this morning.
Thank you.
Yeah, because I believe that so many people that listen to us, they have learned one or two from all we have discussed right here today, and we want to appreciate you for being here today.
Thank you.
All right, just to let you know that, this fight to end obstetric fistula, men, we all have a role, we all have a part to play to see that we reduce this to the barest minimum. And I want to say a very big thank you for being part of the show this morning. Remember that today is the 2023 International Day to Ending Obstetric Fistula, and with the team ended now, we all will try our best and try our possible best, the stakeholders, people involved, to see that we bring this to an end. Thank you so much for being part of the show. My name is Chidema Oranwa.
And I'm Ajulutuku Okabwe saying thank you for watching.